Good afternoon. Good afternoon. Welcome everyone to Taxfit a la carte. For, for those of you who do not know me, my name is Karoll-Ann Fanfan. I am the CEO of Taxfit, and today we have an amazing show. And when you know better, you can do better.
Yep.
Before I introduce you to our amazing guests, I want to remind you how today you can win the electricity bill. You need to like the live, share the live, like the page, share the page. Guys, we have been doing this for the past 2 years. We are not about to stop paying people electricity bill. Don't be shy in sharing that live. The more you share, you give someone a chance to maybe be the winner today. You don't know how many times that the person that won the electricity bill paid was on the verge to having their light cut off, you know. So
Not to mention, this has been the hottest year, so I know everybody's light bill is high.
I know.
Duke Energy,
Exactly.
I'm coming for you.
So why Taxfit a la carte? It's because I remember when we were in Haiti, people will gather together in parties, right? And there will be people from different lifestyle, different career, and then they will talk to each other about their career. So I realized here in America, people are, if you're not in a line of work, you don't know anything about anything else if you don't go look for it.
That's true.
So I wanted to give back to the community, and I strongly believe that knowledge is power, because
Absolutely.
what you have in your head, nobody can take it away from you. They can take your money, they can take your freedom, they can take everything. But what you know, you will go 6 feet under with it. Nobody can take that away from you. So I thought that was a great way to give back to the community by bringing amazing and interesting individuals to the table, and we talk about diverse subjects. So that's the story behind Taxfit a la carte. So today we are sitting with Vanessa Fanfan, which is an RN, BSN, and she's going to talk to us about if you know better, you can do better. In a few words, who is Vanessa Fanfan?
Before we start, I just want to say that slogan, if you know better, you can do better. I wish I came up with it, but really that was my level 4 instructor who used to say that to us all the time. So every time we made a mistake, it was, if you know better, you will do better. So that really stuck throughout my 8 years as a nurse. And even when I teach now, it's always the same thing. Hey, if you know better, you will do better. So when you know better, you do better.
That's right.
Right. But so I am originally from Haiti, as you know. So Karoll-Ann is actually my cousin.
Yes.
Hey, family time. But yeah, I came to the States when I was about 13 years old. A fun fact is I used to actually live with her when I first came to the States. So it's been a long journey. I'm actually currently in Seminole right now, so that's close to Tampa or St. Petersburg. But most people don't know where that is until you say, oh, I'm right by Tampa. And they're like, oh.
Thank you so much for coming to be on the show today.
Of course, absolutely. I don't know. What is there to say about me? To know me, to love me?
All right. So why, before we dive into the subject, why nursing?
You know, I never had a point in my life where I was like, oh, today's the day I decided I'm going to be a nurse. It was always the choice for me. I'm going to become a nurse. I love to help people. I love to help in general. So actually, I always thought I was going to be a pediatric nurse. And during my residency and my training, you know, I went through a really bad experience. And I realized, you know what? I can't deal with kids dying. So I just couldn't do it. So it was easier for me to deal with adults. So I was still able to fulfill my dreams by helping people. The goal is to become an asset to my community, to make my environment better. Every day as when I go to work, it's always the same prayer. I know God is like, yes, replay. We know, Vanessa. Let me be a light to those around me. May your hand touch them instead of mine. And don't you let anybody go on my watch, Lord, because you know I can't handle that.
That's beautiful. And actually, I truly believe that the most important things about someone's life is the legacy that you leave behind.
Oh, yeah.
So how will others remember you when you're gone? So I really commend you for
Thank
for
you.
wanting to be like a difference in the community.
Absolutely.
And bring something positive.
Absolutely.
You're really a positive soul.
I try.
Okay, so today we're going to talk about a very, very, very serious subject. Matter of the heart. So a lot of people, they have family members that suffer from heart attack or stroke. And we want to know what exactly is that about? How can we prevent it? What can we do? And what are the signs? So that's what we're going to be talking about today. But before we dive into this, you know how Taxfit is very big on positivity and motivation. We believe that positivity is like a shower that you have to take every day.
Absolutely.
And we really love to share with you a positive segment on that show every time that we air. So this is what we have for you today. Please listen with us, and I'll see you after a few minutes.
Where have you been? Why are you here? And where are you going? You look at your life, you look at what you produce. Is it giving you what you want? Are you living on purpose? Are you living your dream? Are you acting on your ideas? Are you doing all you can do? Have you gotten comfortable? Are you procrastinating? Are you evading your own greatness? Are you surrounding yourself with people that can nourish you? Are you challenging yourself? Are you experimenting? Are you learning something different? Is your life an adventure, or is it boring? Why are you here? What brought you here? Investing the time, the money. What brought you here? What decisions are you making right now as you look into the future? Where are you going with your life?
I don't care how hard you fail. I don't care how many times you fail the test. I don't care if nobody don't believe in you. It only takes you believing in yourself to get this thing done. As long as you believe in you, you got the right mindset, you got the right attitude, you can have whatever you like. But if you fall, I need you to fall forward. I need you to fail forward.
Now, are there going to be some moments when you want to give up? Yes. Will there be some moments when it's going to seem like it's impossible? The pain that you're experiencing, the disappointment that you're experiencing, that you're going to say, it's not worth it? Yes, that's going to be right there for you. It's going to be in your face, telling you to go back.
But don't let the distractions distract you. All right? You got to keep moving. Don't stop.
Separate what you do from who you are. That's what the guilt trap is about. All of us have made some mistakes in life. All of us have done some things that if we had them to do over again, we wouldn't do it again. A lot of things that if I had it to do over again, if I knew then what I know now, I would have done it differently. Well, it didn't happen that way. A lot of us, because of our limited vision of ourselves, a lot of us who begin to focus on problems and enable them to overwhelm us, we begin to think that we have no options. We begin to believe that there's no way out. You can always better your best. You can always go beyond anything that you have ever done. And I'm saying that the fact that you're still here, that you're still breathing, you've got some more work, and you owe it to yourself. So when you get up in the morning, that you can look yourself in the face and say, hey, I'm living my life on my terms.
Welcome back, welcome back. That was very deep.
Yeah, it was.
Deep stuff. So which part of of this positive segment talk to you?
When you fail forward. That says so much. That says not only to keep trying, but also you not only are you never giving up, but that gives you an opportunity. You know the saying, there's nowhere to go but up.
Yeah.
So it's like, that's what I get from it. And you know how earlier you were talking about positivity and how you pretty much need your daily dose of it. So it's like, if you keep trying and you keep failing, there's only one possible outcome that's eventually going to happen, is you're going to succeed eventually. Because if you keep trying, you're going to keep doing things a little bit different, a little bit better, a little bit stronger, until you succeed.
Exactly. Actually, keep trying is an exercise for your mind to find a solution.
Have fun, Ann. We're talking about the brain today.
Yes, we're talking about the brain today. Guys, if you're just tuning into the show, welcome to Taxfit à la carte. We are about to talk about matters of the heart, stroke, heart attack. How can we prevent it? If you know better, we can do better. But I want to quickly remind the newcomers that today someone's going to get a chance to have their light bill paid. And the way that you can win, you need to like the live, share the live, like the page, share the page, and comment. Because at the end of the show, Vanessa is going to choose a random number, and we're going to match that number with the comments, okay? And that's how you will have 24 hours to inbox us your light bill, the last four of your social, and the phone number associated with that account, so we can call and pay that light bill up to $300. And it's been very hot, so a lot of people, I'm sure you'll be happy to have your light bill paid today. It doesn't matter if you're in Florida, anywhere in the United States. We have paid light bill in New York, in Minnesota. I mean, we've been all over the place. We have been doing this for the past 2 years, twice a month. Okay?
Just little PSA. Fabi, do what you gotta do, please. That light bill is high.
Yes, comment. All right, so when I reached out to you and we decided what subject we were going to talk, and you shared with me that the heart, stroke, people who lost so many family members and loved ones, that was dear to you. So why this subject is so important to you?
Well, first off, actually, I specialized in cardiac and early on in my career. The first 3 years of my nursing career, I was a cardiac nurse. And the past 4 years have been a neuro nurse. So, you know, I kind of specialize in the two. So it was like, oh, let me tell you about this, you know?
Yeah.
So that was really the main reason. And also because when it comes to like your heart and your brain, it's not like tissues like the liver or your nails or your hair. Because if you cut your nails, guess what? It'll grow back. If you cut your hair, it'll grow back. Your liver will regenerate. Same goes for your skin and things like that. But your brain and your heart, once that cell dies, that's it. There's no reversing that. So it's not as forgiving as other cells in your body where you can say, oh, okay, you know, oh, I jammed my finger, I broke my nail, it'll grow back. No, once you lose the cell in your heart, once you've had a heart attack and you don't do anything about it to prevent further damages, once the damage is done, that's it. It's done. And there's a lot of ramifications that can be avoided if you know better.
Well, I want to tell you that I was very happy when you said you were going to talk about that subject, because I have an uncle recently that had a heart attack, and I was amazed how his daughter, my cousin, was able, when he was talking to her and he was telling her, I don't feel too good, I'm gonna go home. And she was able, by knowing the symptoms, tell him, no, I'm telling you, something's going on, you need to call 911. So they battle a little bit,
right,
back and forth, because he was like, no, I'm just going to sleep it off. How many of our loved ones just went to sleep it off because they didn't know better? And so she forced him to call 911, and true enough, as soon as that ambulance reached my uncle, he had a heart attack. So that's why I'm so passionate and really excited.
She insisted.
Yes, she insisted, because you can't come when I see.
Right.
You know? They don't want to listen. You know, they are the boss. But yes. So, what exactly is a stroke?
Okay. So before we dive into that, let's talk about what the brain represents. So basically, your brain is the control center of your body. So the brain pretty much enables you to feel, think, smell, touch, move, and everything like that. So a stroke really is an interruption of the blood flow to any particular vessel in the brain. So if you have an interruption of blood flow in the brain, then that cell begins to die because it's not being fed. Does that make sense?
That makes sense.
So literally, it's an occlusion or an obstruction or an interruption in the blood flow to the brain.
Okay. So that's a stroke.
That is a stroke. That is
Because
stroke.
a lot of, believe it or not, and I was one of those, I always confuse those, the stroke and the heart attack. So we're going to come back.
But they're similar.
They're similar, but they're not the same thing. So we're
Right.
going to dive into this. But to remain on the stroke, is there a different type of stroke?
Yes, you can have ischemic stroke versus a hemorrhagic stroke. So when it comes to ischemic strokes, you can have a stroke due to an embolism, which is a blood clot that sometimes travels through a larger vessel and then it gets lodged in a smaller vessel of the brain. Or it could be a thrombus, which is people, high cholesterol people. If you have a lot of, it's like a fatty buildup. And then when the blood is flowing through that vessel with the fatty buildup, and then it starts to stick to the edges of the fatty buildup, and then it forms a clot that way, which then again leads to an obstruction of the blood, an interruption of the blood flow. You also have something they call a TIA, which is a transient ischemic attack. I don't want to call it a baby stroke. Although it is the easiest way to explain it, it is a stroke. It's just that your body was able to fix itself and push through that clot. Does that make sense?
That makes sense.
Okay. You also have hemorrhagic strokes. Is pretty much your vessel and one of the vessels in your brain rupturing. Usually, most of the times, it's due to like an aneurysm that bursts or something like that. But we can dive a little bit into that, the different kind of strokes in a little bit.
So the baby stroke, is that the one that they say sometimes that you have and you didn't even know?
Yeah. So
Yeah.
sometimes somebody will be like, oh yeah, I had this killer headache and I had numbness and tingling on on one side of my body, but then after a few hours it went away. Your body is an amazing mechanism. It'll fix things. You have no idea how much you put your body through, and it'll fix itself. But sometimes it needs a little help, and that's where medicine comes in,
So what are the risk factors of a stroke?
Oh man, so there's quite a few. And they're very similar to the risk factors for a heart attack.
Okay.
But you have what you call modifiable risk factors versus non-modifiable. So the non-modifiable risk factors are going to be age. So usually we tell people if you're older than 55 years old, you're at a higher risk than somebody who's younger. Race, African American, for some reason, they are at a higher risk. I know. Why?
Well, we cannot get it all. We have beautiful skin.
Right. There's also family history of a stroke. There's also history of having a prior stroke. So your risk is higher. Once you've had a stroke, you have a higher risk of having another one.
Yeah, it's calling his friends.
Yeah. It's like, hey, we got this one. Let's try it again. Unless you change your lifestyle and you make some changes, you take your meds and things like that. The modifiable risk factors are going to be things like hypertension. I know a lot of people don't think about that. Oh yeah, my blood pressure is high. But listen, hypertension is a mother of an issue,
Of the stroke.
Yeah, well, not only for stroke, but it'll eventually affect your kidneys and all kinds of things. So really, people, there's so many places you can check your blood pressure for free.
Exactly.
You can go to CVS, you can go to Publix. Hey, Publix. You can go to Publix and check it for free.
I know you love Publix.
So, yeah, 9 years. Heart disease is also a risk factor. You have diabetes, and people don't think about that. Oh, yeah, diabetes is just your blood sugar, but it actually puts you at a much greater risk of having a stroke or a heart attack.
So you're old, you're black, you have diabetes, hypertension.
Smoking.
You're a magnet.
Smoking people, smoking.
Okay.
Obesity, high cholesterol, and of course doing recreational drugs like cocaine. Don't be mixing that baking soda. That's not good for you. So these are your main risk factors.
Okay.
Really.
So then, what would be the sign? Because that's what saved our uncle, that she knew the signs and the symptom.
Right.
So,
for a stroke, the signs are very typical.
Okay.
It would be like numbness or tingling or weakness to one side of your body. Vision changes. you know, sometimes somebody would say like, oh, my vision is blurry, my blood sugar must be low. No, but it could also be that you're having a stroke. So stop dismissing things and making them less than they actually are. Okay, so speech impairment is also a sign. Loss, like losing your balance.
Okay.
What else?
Actually, I had a client that was telling me she was shopping at the mall, and then she realized that she was trying to pay at the cashier, and then suddenly she couldn't. But because she knew the symptom, again, can you believe this? When she said that, why cannot say what I want to say? And she dialed 911, and as she was dialing 911, she just fell on the floor.
Wow. That's crazy.
So that's very, knowledge is power.
It's power, for
okay?
sure. And another one that people don't think about, another sign is the headache. People who are having a stroke report having the worst headache of their lives. A headache. Now, listen, to those of you watching, I'm not saying every time you have a headache, you're having a stroke. I just have to put that disclaimer out there, okay? I'm not saying every time you have a headache, you're having a stroke. Honestly, when I first started on the neuro floor, anytime I had a headache, I'm like, it must be happening. It must be happening, people. That's it. I have a headache, you know. But it is a sign. Sometimes, and I mean, really, a really bad headache. People report like a headache that's not. That even if you take Tylenol and ibuprofen, the headache is still persisting. You should definitely go see your doctor because it could be a number of things.
Or go to the emergency room.
Yeah,
I know
absolutely.
that a lot of people in the community do not have health insurance, and every time they're like, oh my God, I'm going to be responsible for that bill. But listen, anything can change as long as you're breathing.
Absolutely.
Once you're not breathing anymore, so it's that $400 bill of the emergency room. I know maybe you don't have it, but it's worth it if it's going to save your life.
Absolutely.
Right?
And you know, there are programs that help you pay certain bills too, like especially if it's a medical bill. So just think about that. But you know what? Let's just to make it easier for you guys to remember. So I know I said a few different, a few different. So we have this acronym that we use is called Be Fast. And the reason why this acronym is so appropriate is because if you're having a stroke, time is of the essence, literally. Time is of the essence. So if you can remember Be Fast, literally Be Fast, it'll help you remember the signs and symptoms, but it's going to be a trigger for you, like I need an intervention like now. Okay, so B is going to stand for balance. Like I said, you know, sometimes you lose your equilibrium. B stands for balance. E is going to be for your eyes, so your vision. If you're having, all of a sudden, you can see out of one eye, all of a sudden you're having blurred vision and things like that, right? So that's BE. F is going to be for your face. A lot of the times when somebody's having a stroke, they have a facial droop. So their face is no longer symmetrical. BEF. A is going to be for your arms. You can ask the person, very simple question. Let's say you think a sibling or a family member or friend is having a stroke, and you can tell them, hey, can you raise your arms? If they're holding their arms up and one of them is starting to drift, that's definitely a sign.
Wow.
Yeah,
okay.
So A would be for arms. S would be for speech. If all of a sudden you're talking to them and it's not registering to them, or if they're starting to mumble their words like a drunk person. Because it's not just a matter of me not being able to express myself, it's also me not being able to comprehend the information that's being given to me.
Oh, wow, okay.
So that would be your speech. And T, time is of the essence, chop, chop.
I like that. I'm definitely going to remember that.
Time is
fast.
of the essence. So T is really time to call 911. Make something happen. Don't wait when it's too late.
So let's say if you reach the part where you mumble your words, do you still will be able to call 911 or everything?
Well, hopefully somebody will be calling 911 for you. But I mean, everybody's going to be different. It's kind of like asking me, oh, I have a cold today. How long is it going to last? It's kind of individual.
I have a question, and it's about urban legend. Okay. So is that true if you really had a heated argument with someone that can lead to a stroke? You know how in our country they say, oh, she had an argument with that person and she went home and she had a stroke. Is that true? Or
I'm going to say yes, because stress is a factor, is a risk factor.
Okay.
High stress level.
Okay. So if unfortunately that happened, can we tell them briefly the treatment, about the treatment?
So if well, when you make it to the hospital, let's not say if. When you make it to the hospital, they're gonna run a series of tests. I'm not gonna indulge too much in the type of test because you may not understand all that's being done to you, but the basic things is time is of the essence. You have a good 3.5 to 4 hour window where they can make an intervention that will literally reverse all your symptoms, or most. So the first thing they're gonna do a CAT scan to make sure you're not having a brain bleed, because they have this medication called a PTA. It's like an aggressive clot buster, okay? The TPA is given to the patient. Again, you have that 3.5 to 4 hour window to be able to administer it for it to actually make a difference. So sometimes, like at my hospital, because I am a stroke nurse and I am also a charge nurse, so all the new strokes that come to the hospital, we respond to them first. So when we giving them the TPA, it's amazing. Like sometimes within like 10 minutes, their symptoms are already going away. So sometimes they come like, oh, I can't lift my arm, or I can't move my leg. And then we start giving the medication, I kid you not, and like it's like magic almost. 15 minutes, 20 minutes, and all of a sudden they're moving, they're able to grasp your hand, they're able to kick, and it's like, wow, so the reason why we do the CAT scan is because we need to make sure that they're not having a bleed in their brain, because the TPA, again, it's an aggressive clot buster. You have a very high risk of bleeding. And of course, you have to be a good candidate for it. If you're over 80, you're not a good candidate because your vessels are a lot weaker. So then there's a very high chance you'll hemorrhage. It can't be a seizure. There's quite a list, but of course, your medical professional team will know if you're a good candidate for that kind of medication. So after they do that, a good test that they run is an MRI. It helps them visualize the brain a little bit better, so they can see where exactly your stroke was. If you really had a stroke, they can see how bad it is.
Well, I want to say something about the timing, because timing is very important. I would advise, if you have like your parents, because you said age is a big risk factor.
Absolutely.
So you need to have some type of plan, because I have stories are coming to me, as we're having that interview. So I had a friend, and what happened is because her dad stayed on the floor too long. So he was home alone and he had the stroke. And it stayed for at least 6 to 7 hours.
And this is where it becomes dangerous, because remember, like I told you guys earlier, your brain and your heart, they're not as forgiving as certain cells in your body. Once that tissue dies, it's gone. So if you were able to, let's say they had noticed their father was on the floor a lot sooner than
a lot sooner.
So let's say they were in that 3 hour window. They could have administered that TPA before the cell actually dies. Because remember, it's not like you get a blockage and now it's not getting nutrition or it's not getting blood flow to it and then it dies right away. It takes a little minute to die. So at this point, you have a tissue injury. But when you get to past that 4 hour mark, the cell is dead.
So that's how I like your motto. If you know better, you can do better.
Absolutely.
I know. When I talk, I always quote my community, because that's what I know, right? I'm from Haiti, and in our community, it's like the older people, the Gamoon, they're in denial. So don't be in denial. Have a plan. There's so many things here that you can do. You can have that life alert pendant, or you can agree that your children check on you so often during the day.
Right.
It's not that you're getting too old and you want to be independent, but those hours for that stroke can make the difference of you becoming
disabled.
Yes, exactly. Major difference.
Yeah.
So we wanted to, the stroke and the heart attack are very similar, but we wanted to like kind of do a contrast with them. So that was it for the stroke. I know you guys have been buzzing with questions, and we're going to come back to your questions.
Just remember, before we finish, be fast.
Be fast. That's for the stroke.
Yes.
Yes, definitely. That's going to stay with me. Thank you so much. So what is a heart attack now versus a stroke?
Okay. So you know how the brain is the control center of the body? Well, your heart is the main pump of the body. So that being said, it's almost like a stroke. If you have an interruption or a blockage of the blood flow to the heart, then you have a heart attack. So it goes back to the same concept. If you have a blockage or an interruption or an occlusion to the brain, it's a stroke. If it's an occlusion or an interruption or a blockage to the heart, then that's a heart attack.
I wonder where that name came from, a heart attack.
I'm not sure, but I'm sure the people who are feeling it, it's the heart. Hey, I'm under attack.
So like the stroke, is there different, I don't know, that might sound like a funny question, but is there a different type of heart attack or just one?
So it's not that there's different types of heart attack. So you know how with the stroke, I told you, you can have like an embolism or you can have like a thrombus. So the heart attack really is, again, I mean, it's not the same thing, but it is similar because you can have a thrombus. So it's again that fatty collection. And then, of course, with the blood flowing, it adheres to the fat, and then it causes it to have a clot. And then you have that obstruction again. So it could also be a blood clot that traveled from somewhere else in your body, and then boom, you have a heart attack. But here's the thing that a lot of people confuse with a heart attack: angina. Interesting word, right? Angina.
Why did I say that?
No, really. Angina is very similar to a heart attack, and I'm going to tell you how. So whenever you're having angina, but it's mostly felt when you are like, when your heart is working harder than it usually does.
Okay.
That would be like any physical activity. You ever, I don't know,
It's like
anybody?
if I start running right now.
Right, and then all of a sudden you're like, my chest.
Oh, okay.
You're not having a heart attack.
Okay.
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 So sometimes when people have angina and they're like under a ridiculous amount of stress, and sometimes people are like, oh, she's having an anxiety attack, you know.
Uh-huh.
So you have that ridiculous chest pain, and then
Yes.
you feel that tightness. And then with some people, it'll proceed as being like jaw pain or back pain. It'll extend to their arms, which is all signs of a heart attack, by the way. You know what I mean? But here's the difference. When you're having an angina, if you rest or if you take nitro, the pain and the discomfort should go away. Now, if you're having those same symptoms and you take nitroglycerin, which is a medication that will dilate your vessels to help the blood flow better, right? If you take nitro and you rest and the pain is still there, there's a pretty high chance you're having a heart attack.
So it's not all of a sudden.
No.
There's
Yeah, you have signs.
Yeah, signs that, okay. So that what are the signs of the heart attack now?
So the signs of the heart attack would be, you know, just like I said, chest tightening, sweating. Some people will have the jaw pain, the back pain. Sometimes the pain will radiate to the arms, either arm, really. Sometimes people will report dizziness. Which is, you know,
my God,
this,
I'm going to become so paranoid now.
this is a symptom that a lot of people don't think about, but dizziness is one of them. But I got something for you. Just like we have Be Fast, I want you to think of a song every time you think about what the signs and symptoms. Well, at least this is what I teach my students, okay? Stop in the name of love.
Really?
You know why? STOP is actually the acronym.
Okay.
But because it's the
So
heart,
first,
I
so
always
be
think
fast.
of stop in the name of love. So STOP. This is what it stands for. You ready? S is for shortness of breath. Okay. T is going to be for the tightness in your chest. O is going to be for other symptoms like dizziness and sweating, right? And then P is going to be for pain, the chest pain, arm pain, back pain. So stop.
Call 911. So the shortness of breath, it will be like I could be sitting normally and then I start, that's...
Now, listen, if you're having a little palpitation, don't all of a sudden tell me, Vanessa, I'm having a heart attack.
Vanessa, I'm going 911, girl. All the way to seminar, there's nothing you can do for me, okay? So I like that. So be fast for the stroke and then stop in the name of love.
Yes, in the name of love. And I want to bring something else up that I didn't mention. You know how you were asking me if there's different kind of heart attacks, and I was telling you different ways you can get, or different things that can cause you to have a heart attack. Spasm, you guys.
What do you mean?
Coronary artery spasm can cause you to have a heart attack because it will obstruct the blood flow to an area of your heart. And you know what causes, Well, there's not a real known cause of coronary artery spasm, but there has been studies that show that nicotine. I don't want to be a.
I see that you're not a fan of the smoker.
No, Dad. Bobby.
I don't know if he's watching.
No, but smoking and cocaine use are actually very high on that pole of what could actually be causing
A heart attack.
coronary artery spasms, which will lead to a heart attack. So think about that.
So cocaine is very bad.
Cocaine is very bad.
Ouch. So that was the signs and symptom, right? So remember, stop. Okay?
Stop.
Okay. So from there, what can you do to prevent that? I guess exercising,
Yes.
eating
So
clean.
you know the risk factors that we talked about for stroke are very similar to the risk factors for a heart attack.
Yes.
So it would be, again, older than 55 and up. I know 55 sounds like a good number. I'm not saying if you're 55 and you're watching.
If you're under 55, don't do anything. If you have shot,
No.
You're right.
That's not true. Because if you have risky behaviors, like if you're a smoker, you do other things, heavy drinkers.
Oh, I love my drink.
Heavy drinkers.
What is
It
it?
is a
Heavy
risk factor.
drinkers? Like, one glass of wine then.
Oh, that's nothing.
Okay.
I'm talking about the heavy drinkers, the drinkers.
Okay.
But again, non-modifiable risk factors are going to be age, race, family history. But here's one thing that stroke doesn't have that for heart attacks is a risk factor: being a male. For some reason, they have a higher risk at having a heart attack than females do.
Wow. Ouch.
Maybe because the females are always stressing them out, huh?
I don't think so. They're stressing us.
So the modifiable risk factors, again, are similar. It's going to be smoking, drugs, high cholesterol, you guys. High cholesterol, hypertension, high blood pressure, inactivity.
What activity?
Inactivity.
Oh, okay.
A sedentary lifestyle.
Yeah.
Think about that. Obesity, stress, diabetes. Diabetes is something. You should do a whole show about diabetes, but grab a doctor. I'm a nurse.
Definitely.
And again, we talked about alcohol. You know why alcohol is a problem? Because alcohol actually raises your triglycerides levels.
Okay.
So when your triglyceride levels are really high, you have a higher risk of having heart failure and of having a stroke.
Actually, certain alcohol, when I consume them, I can basically feel my heart is hurting. And I'm like, okay, it's going to pass.
I'm not a drinker, so I don't know all the details on how exactly alcohol will affect you, but I know it's a risk factor.
Okay, guys, let's take some of your questions. I would like to thank everybody that tuned in today.
Wait, before we take the question,
yes.
I just wanna point a couple things that I really wanted to remember to tell you guys. So just because our uncle recently had a heart attack, if you've had a heart attack, just remember that it's not the end of the world. If you had interventions done and everything like that. A lot of questions that I used to get from my patients is, what do I need to avoid now that I've had a heart attack? The main ones that people don't think about: avoid extreme temperatures. So stay out of the sauna right after give your time self to recover. Another thing people don't think about: do not eat a large meal. Break it up, 3 or 4 smaller meals, because the larger your meal, the harder your heart works, because your body has to break down all of that. Think about that. And a lot of people don't think about that.
Yes.
And that's according to the Heart Association people, just so you know. I didn't make that up. Another thing people ask, can I still have sex after a heart attack?
That's a good question.
No, you can. You can have sex. And it's almost like after you had a baby, they give you like a 6-week period. So after a heart attack, give it 3 to 6 weeks and you can absolutely have sex. Fun fact. Let me tell you guys, fun fact, okay? The energy it takes for you to have sex is actually less than the energy it takes for you to climb up 2 flights of stairs. So my advice to you is,
before you start climbing stairs,
no.
I'm just kidding.
If you can go up 2 flights of stairs and not be short of breath after you've had a heart attack, then chances are you can have sex. So if you can't wait that 3 to 6 week period, because I know some people are like, oh my gosh, you're 6 weeks, I'm not gonna make it, or your wife is not gonna make it, whatever. But but if you can climb up 2 flights of stairs without being short of breath, without having the tightness in your chest and all that stuff, then chances are you're probably ready to have sex. Just saying, just throwing it out there. Food for thought. I don't know what's important to you, but that was definitely it. You know, if I ever have a heart attack, sir, can I, just saying.
So we are going to take some questions. The team back there, do you have some questions you want to tell us? Or
she answered most of them, but Vanessa Fanfan just asked if she won the light bill yet.
Oh my gosh, Naili, be patient. Fabi, I hope you read your texting.
Kisha Cerisier just said, why do you think individuals ignore modifiable risk factor to prevent such devastating medical emergency like a heart attack? So
lack of knowledge.
Yeah.
Lack of knowledge. Because people don't realize how serious it is. People don't realize how serious it is because medicine has advanced, has gone so far. Like I said, you know, we can give you that TPA medication if you qualify, right? And it completely reverses all your symptoms, right? And people in their mind, they think like, oh, you know what? If that happens to me, they can fix it. But let me tell you something. A lot of the times we cannot fix you. So those of you out there who have modifiable risk factors that you can work on, I would advise you do so. Because I don't know about you, but we're only getting older on this side of town. You know? So just think about that. And a lot of people dismiss it because they always think, oh, it's not that serious. I've had chest pain before. Oh, it's just a headache. I've had headaches before. Oh, I suffer from migraines, so why worry about it? But if your migraine is not relieved by anything, let me tell you something. Show up to the ER.
Yeah, definitely. Definitely.
You want to know a little joke? What a police officer told me, anytime he's arresting somebody who don't want to go to jail, the first thing they say is chest pain. They have to take them to the hospital. They have to. Did you know that?
No.
Just saying.
Really, Vanessa?
Don't flood the ERs, people. If you get arrested for a DUI or something, all of a sudden chest pain. But it's been known to happen.
Okay. Actually, I was going to ask you to share with us a funny story in your line of work.
Oh my gosh. So I got slapped before. She was cute. Ish. She was cute. She was an older lady. And come to think of it, now it's funny, but at the time it really wasn't. So I was taking care of this little lady years ago, and she was confused. And funny thing, she came for chest pain. Imagine that. So anyway, she told me she was hungry, and you know, me being super nurse, I'm like, I'm gonna make you a sandwich out of love. So I did. I went down to the kitchen. I was working nights, so the cafeteria was already closed. So I went down there, I made her a sandwich with love, okay? And you know, I cut it like, you know how you cut your sandwich like a little triangle like you do for the kids. I took the crust off. I mean, I went all out, you know? And I gave her sandwich. Now, mind you, she was a little bit demented, so she was a little confused. And she said to me, oh, thank you so much, and blah, blah, blah. And I'm like, you know, that made me feel so good. You know, it's the little things that matter. Anyway, she ate half of the sandwich, and she took the other half, and she's putting it under her gown, you know, like, and I said, oh, honey, it doesn't go there. You can leave it on the plate. This is not sanitary. Don't put it down in your cookie pop. That makes no sense. So, you know, I took the other half of the sandwich, and I put it back on the plate, and I sat it on the table. And she took it, and again, back to the older population being very stubborn. And she put it back down there. So now I'm like, honey, this is not a clean area. Let's not do that. I took it again and I put it on the plate. So then she's like, it's mine, you gave it to me. And I'm like, I'm not gonna eat that. You know, I know I gave it to you. It is yours, but what I'm saying to you, it doesn't go there. So now here I am arguing with a confused patient. Now mind you, that was very early on in my career. Because now if a patient is arguing with me, I just walk away. You know, I'm not getting slapped again ever in my career. So long story short, we kept going back and forth, and what she did, she grabbed the sandwich and then she took her covers and she wrapped her arm with my arm, because I'm holding the sandwich and she's holding it too. Now, we had a tug of war for a freaking sandwich, you guys. For a sandwich, a turkey sandwich at that. It wasn't even a steak and cheese.
It was made with love.
Yeah. So So now she took her sheet and she wrapped my hand in her hand in the sandwich in the sheet. And I'm like, seriously? So mind you, I'm sitting by her bed. So her bed is like, her head is right here and her legs are this way, right? So I'm standing on her left. So my left hand is wrapped up in the sheet with her left hand. Mm-hmm. And so now I'm trying to undo the sheet with my right hand. And then I'm not paying attention to her right hand. She caught me with a right hook. You know when you watch cartoons and then you hear when somebody gets hit in the head and you see the little birdies and you hear that stuff is so true. She slapped me so hard, my ear went beep for like 20 minutes.
Oh my God.
20 minutes. And so, you know, I grabbed her hand and I said, don't you do that again, you know? And so now I'm mad. So I unravel the hand and then she looks at me and she say, what happened? Did somebody hit you?
That's so funny.
I was like, seriously? I threw away the sandwich, by the way. I was done. That was my mean moment. But I went out there and the other staff member who was in the room with me, she thought it was so hilarious. And she's like, ah. And I see her laughing, but I can't hear her. All I'm hearing is beep. Like 20 minutes.
I actually had a client punch me once because her refund was so big. She was like, get out of here. Because for the past few years, she was always paying back the IRS. And I actually got her a refund.
Oh my God.
It was actually huge.
Get out of here. Make that happen for me today.
You know I do your taxes. Anyway.
If you need your taxes done, by the way, I know this is not a commercial, but listen. She gonna show you the money.
Yeah, I give you get out of here treatment.
Right.
But yes, I don't like violence, and I didn't like that at all.
Well, I don't think anybody likes to get hit.
Big for amazing refund. So can you remind them, because I think that's important, what can you do? Actually, before we go to that, let's talk about after you had a heart attack, some changes that coming to you, because I had somebody that she didn't really understand what was going on, like loss of memory. They need to be patient with that with that person because they're not gonna be the same right away, right? Mm-hmm. So what some of the symptoms?
You do have to be very patient. Well, not symptoms, but you do have to be patient with yourself and with your family members, depending on which one you are. Mm-hmm. When you've had a stroke, I usually tell my patients, like, it takes a year. Within the first year, that's when most of your recovery happens. But it's not unheard of that you're still progressing after that year. So keep the faith up, keep the positivity up, and make sure you listen to your doctors. Take your medications.
Yeah.
Take your medications. And a lot of people will stop taking their medications as soon as they feel better. Please don't do that. Please do not do that. Just because you feel better does not mean that everything is all well.
Yeah.
So take your medications. Fun fact, according to the Heart Association, you like dieting alone, right? I don't mean like diet, portion control, blah, blah, blah. I mean modifying your diet. Like you can control at least 3 risk factors just by altering what you eat. So if you increase fruits, vegetables, grains, decrease meat and fat, you can actually affect heart disease. You can decrease your risk factor from heart disease, diabetes, and obesity. Just think about that. Just eating right. You just knocked out 3 risk factors.
Eating right is a huge one.
Yeah.
And it's a lifelong battle.
And it helps with your cholesterol too, depending on what you eat.
Okay, guys.
Exercise. And I'm not saying for you to go get a gym membership right now. It could be something small. Walk around the block.
Exactly.
Don't
it does
stay
count.
inactive.
It does
Be
count.
active.
Yeah.
Absolutely.
I mean, yeah, definitely.
Yeah.
Going around the block, and actually, you can keep up, like, be more regular walking around the block than during the membership.
Yeah, that is very true.
I had I have a gym membership for the past 2 years, and I didn't show up. But when I walk around my block, it's like it's easy. I walk around my block.
Yeah. And you know, there's no restriction on what time you got to do it.
Yeah.
So that's why sometimes it's better.
So we are approaching the end of the show. That was very, very informative, Vanessa.
Thank you for having me.
Appreciate you coming here. You have a last chance, even though if you just type right now Taxfit in the comment. You have a last chance to enter those comments. So we don't know what she's gonna choose, a random number in a few minutes, and you can be the winner. So comment, like the live, share the live. You still have time now. I give you 30 seconds. You still have time, okay? So before that she choose the number for the person who's gonna win, I want to remind you that a lot of people think after April taxes is over. No, it's not. A lot of people do not know that if they didn't do their taxes for the past 2 years, they still have time to do it. So I get a lot of international people in other countries, especially Haiti, and they didn't know they can still do their taxes, and they come and do a couple of years taxes for many reasons. So that's why Taxfit is still open, and we still can address your questions about taxes.
Right.
So
Pay your taxes, people.
yeah, and then if you didn't pay your taxes, the IRS is always willing to make an arrangement with you. It's not the end of the world. I had a client the other day. She was like, I'm going to jail. No, you're not going to jail. As long as you want to address the issue, you want to make an arrangement. People who go to jail for tax evasion are people really who doesn't want to do anything, okay?
Because where there's a will,
yeah,
there's always
actually,
a way.
The IRS has the whole time in the world to wait, so they are willing
But that
to
is
wait
true.
and cooperate, all right?
That is true.
So,
Hey, same goes for your medical bill. Pay them,
yes.
please.
Okay. The newcomer said, am I late? No, you're not late. Put more comments. Like the live, share the live. You don't know. You might be the winner tonight. Thank you so much. So, it's time to choose our winner. So what number comes to mind?
68.
68. And why? Why 68?
Because I didn't want to go with 69.
Okay, should I not ask why? I'm just kidding.
No, 68 just sounds like a happy number.
Number 68. 68. 68. So,
It's Carly Vielo.
Carly Vielo, and it's not the first time that she's winning.
What?
Yes. So you see people.
You a second-time winner?
I think it's a third time. Many people here won multiple times.
Inbox me. I'm going to send you my light bill.
But anyway,
Be kind.
I want to dedicate that Taxfit à la carte to Faja Tassi,
Yes.
who saved a life by knowing the symptom.
Absolutely.
Okay? So
Papi
educate
Jean-Jean,
yourself. Knowledge
love
is
you.
power. She saved a life by saying call 911.
Yeah. And I hope you guys got to learn something new
Yes.
today.
Fast.
You
Be
know.
fast.
Be
And
fast.
stop.
Stop. In the name of
Well, it
love.
was a pleasure being with you this afternoon. Thank you so much, Vanessa, for coming all the way from Seminole to share that time with
Thank you
Taxfit
for
à la
having
carte.
me. Thank you.
We will be here in 2 Tuesdays, and I'll see you. Thanks.
Bye.
Bye.